So this is what we're doing today. So intros, we're going to give a recap on how we've come about. Danny's going to do a session for us on language, physical activity. Andrew's then going to do something about framing, what is framing, and then we're going to have plenty of time at the end for discussion, hopefully some breakouts as well. And as I explained, we're an amalgamation of some different organisations. So that's who's involved, ourselves and our colleagues from Wales. So why are we here? Because we're passionate about movement. Movement matters to us all. It matters to workplaces. We need to design movement back into our everyday life and where we work, and we all have a role to play. That's essentially why we wanted to come together, and we wanted to share that with other people. And we guess that's why other people are here, is to find out about how we do that and what our role in that is. So how have we come together with our Welsh colleagues? So you might not be able to see that so well, but basically, back in 2023 at our GM Moving Conference, there were some colleagues from Wales came along to our conference, and they heard about active souls, and they're like, oh, we really like that concept. Wanted to take it back to Wales and think about how that could happen in Wales, and they actually launched that in the summertime. So they launched the new strategy and the concept of active souls. They then had a spread and scale academy, which was about how do we share this concept across Wales. They came to us for some support and help with that, about understanding what we'd done in Greater Manchester around that. So we provided a little bit of support and guidance and worked with them on that. And from that, one of the outcomes was that we wanted to look at a community of practice about how we could do that across the country, not just across England and Wales. So from that, we then wanted to think about what that could look like. So we had a bit of a testing session in January, which was absolutely fantastic. And some of the feedback from that was there were some common themes that we identified. So what we did from there was think, right, okay, let's make sure that those sessions are themed so people can come along to the sessions that they feel that they want to discuss most, if it's something that they feel that they've got something to share, or if it's something they want to learn more about. Hence, we've got these 3 dates in. Language, messaging and framing came out really, really strongly in January. Measuring impact and learning, influencing stakeholders, senior leaders and culture also came out really strongly. So this is the one that we're looking at, language, messaging and framing. I'm going to hand over now to Alex just to talk a little bit more about the whole system approach and why it's important that we don't just think about one size fits all, I guess. So Alex, over to you.
I've got slight connectivity issues today, but I will do my best to stay on the call or join on my phone. So thank you, everybody. So most people on the call today will be familiar with the wider determinants model. Essentially, it's a visual representation of all the factors that collectively impact on an individual or population health outcome. And by addressing all of these influences in everything we do, we can then create sustained systems change. A few years ago, Hayley Lever added an extra layer called cultural norms and ideologies. And this addition in Greater Manchester has been a complete game changer. And it's made a difference to us in Wales on how we talk about movement. It helps really emphasize what surrounds us, shapes us. It's helping to change the stories we tell and the way we talk about movement. And it's very much around the language we use, the beliefs we hold and the ideas we embrace shape the world around us and how we interact with it. The elements form the foundations of the cultural norms, which before we hadn't really thought about, and how these cultural norms influence our behaviours and our decisions. So for workplace health, the cultural values of physical activity are high, then we're more likely to integrate movement as an individual into our daily routine. So the next slide, please, boss. So in March, we ran a similar workshop in the Greater Manchester.
Oh, we might have lost you, Alex.
There we go. I'm back, sorry. Actionable examples they had across the layers. Don't ever get 3 mobile, they're rubbish. So, for example, for the top ones, we've got senior leader buy-in. So having something like Active Soul, saying that changing the cultural norm of workwear to we wear active shoes, and through wearing active shoes, we can now walk. We can do walking meetings. We can do standing meetings. We can have standing desks. Changing physical activity norm for how we can have flexible working and active travel miles, so that you're paid the same to cycle in as you are to drive in between meetings. Making sure that we've got the facilities and the cycle storage to be able to cycle into the office, and making sure that we've got the changing rooms. Making sure that we've got people knowing around active travel and wearing comfortable clothes. So it's all through the layers, if we have all of those, but starting with a really important part of social norms, and changing the underlying values of what's important to a workplace, so that it's how you can sell it, like fits as personal well-being and professional success in the workday. Thank you. Good timing. So this is just reinforcing that if we work with the cultural norms and ideologies, then it has a sustained impact. Often I've worked in public health for about 20 years now, and we often work with individual layered interventions, which are very easy to implement and very easy to assess, but the likely sustained impact is very short. So I don't want to dwell on this too much, but it's just making sure that we've got a model in our head for how this works. So I am going to pass on to Daniela, if that's okay. Feel free to put any questions into the chat.
Well,
yeah,
thanks,
just to say, yeah, people are hearing things as we're going along. Just make sure if it's something, just put it in the chat, and if we've got time, we'll make sure we pick up on that in the end. So yeah, just keep using that chat function. That's great, everybody.
Well, thanks, Alex, and thanks, Claire. I'm Danny Roberts from Proper Active. So we're a strategic research and learning consultancy, and we specialise around research into physical activity for health, wellbeing, and sort of wider community benefits. And we work mainly in work with audiences that are not engaged in those kind of traditional sport and physical activity environments. So language is something that comes up a lot in the work that I do. So I'm really pleased to be able to share a little bit of what I've learned about the impact of what we say, and the language we use, and how that kind of affects really how people feel about being active. So I was keen to start us off with a little bit of a task. So it's not just too much listening this morning. So it's going to be a really short one to start off with. We're going to do another one a little bit later. So are we going to have breakout groups for this, Claire? Is it going to work?
Yeah, I think so. Yeah, so I'll put people into groups of 3 and 4. Does that sound about right? Less than that, more than that? There's 19 of us.
I realised I actually share my slides, did I? That would help.
But rooms are 3 and 4. Is that okay, Danny?
Yeah. So
brilliant.
Slides should have come up.
Yeah.
And I will explain the task. So, what I want you to do is imagine you're in the office and a colleague's just arrived in the office. You know, typical morning. Everyone says hi, how are you? That sort of thing. And then one of you says to the colleague that's just arrived, "Oh, what did you get up to last night?" And that colleague says, "Oh, I had football." Now, what I want you to do in groups of 2s and 3s, you're just going to have a bit of a chat about how you might respond when someone says that. You know, what sort of things might you say? Maybe what questions might you ask them just on a typical day, or what sort of things maybe you heard other people respond to something like that. Does that make sense?
How long do you want? 5 minutes?
Yeah, if we have about 5 minutes, because people probably want to do a quick intro to whoever's in their little group as well. Okay, how do we find that? Anybody want to share anything that they sort of talked about in their group, either in the chat or just shouting out?
I'm happy to shout out. in our group, we just wanted to kind of explore, because you'd been very vague. You said I had football. Football could have been sitting in your pub with your mates, or watching like England was playing last night, or it could be the child was playing football, or it could be that they were actually playing football, in which case you'd start the conversation. Did you play 5-a-side? Was it a full team? Who was playing? You know, that kind of thing.
Okay, well, anyone else? Let's use our little emojis then with the thumbs up. So anybody ask questions like, do you play for a club or a team? Or did anyone ask, was it a match? A few people, yeah. Anybody ask the score or how you got on, things like that? Did anybody ask who you play with, or whether you enjoyed yourself? Did anybody ask that? A couple of people, good. So the reason I kind of wanted to start with this and explore this is we kind of think these conversations are quite innocuous, but actually those different kind of responses and those different types of question can make you feel quite differently about the activity that you do. So some of those questions like that ask about whether you play for a team, you know, what the result was, what's the score. We set a sort of certain expectation around certain activities, that there is almost a right way to do that activity, and there's an expectation of what that looks like. So if somebody did just have a kickabout with the kids in the park, they might feel like that's not proper, or you know, it's not really actually football. I certainly know I've heard a lot, if somebody says, you know, I did football or another similar sporting activity, what might happen is somebody says, oh, how'd you get on? You know, did you win? And they go, oh, it's not a proper team, you know, I'm not very good. And it almost immediately makes the person sort of slightly have to justify their situation. So we often think about very little about these things, you know, they're just sort of throwaway conversations, but we don't realise the impact, I guess, that we're having on other people. And I think if you're someone who's really good at sport, physical activity, or you're a marathon runner, that's brilliant. But if you're someone who's a bit more like me, I'm more of a person who tries hard. I'm not really very good at anything. These kind of conversations can have quite a big impact in terms of how we view our own efforts to be active, and really sort of define what we think is worthwhile. And I think, my slides again. I think something that's really interesting is that this kind of whole range of different types of activity that people might be doing, and the types of questions we ask about different activity can be quite different. There's a real sort of set of social norms, like Claire was talking about, that sort of go with particular activities. So the question we might ask, if someone said they were going for a run, or if they said they took the dog out, might be quite different. And I think it's quite important that we think about the impact we're having in these sort of day-to-day exchanges. You know, I think in the end, all of us, we really want people just to embrace being active in whatever way works for them, you know, whether that's an ultra marathon, or whether it's walking around to a friend's house for a brew. So I think that also plays out in wider conversation in the workplace, you know, whether we're talking to colleagues, managers, clients, or anybody else we encounter in our workspace, in terms of how people feel. So what I wanted to do is highlight kind of 4 different languages that I see all the time in different aspects of my work. These aren't like the only ones, but they're just ones that come up really commonly, just to get us thinking about the different types of language and how that affects different people. So the first one is about competition. So we've kind of touched on this a little bit in the that opening task. So competition often very associated with more conventional sport environments rather than some of the wider physical activity options that we might think about. And competition is brilliant in lots of situations. Lots of us love getting stuck into something competitive. We like watching it on TV, as was alluded to just before. But it can also be a little bit intimidating if maybe you're not really confident in a sporty environment, and you're a bit worried maybe that you're not going to be that good at something. So in a workplace setting, we do see competition in kind of workplace active initiatives quite a lot. We see things like step challenges or interdepartmental leagues. We sometimes see teams entering events like distance running or cycling events, things like that together, and that can be absolutely brilliant for some people, but it doesn't always quite fit for everyone. And those who aren't comfortable in that sporty environment, they might be thinking, nah, I'm not going to get involved in that, because the last thing they want to do, frankly, is show themselves up in front of work colleagues. So the way we present different opportunities can really reinforce, I guess, traditional stereotypes that being active is only for certain types of people. So moving on to the second language, this one is around appearance. So this is often associated with fitness, often associated with weight loss, and it creates a real sort of social norm that active people are beautiful, they're slim, they're toned and fit, and also that you need to be all of these things before you can actually be an active person. And of course, I'm not having to go at the fitness industry. There's loads of great stuff happening in that area. But unfortunately, we do also see a lot of spaces where, we talk about summer body ready, or no pain, no gain, and being your best self. And I think this kind of language, it almost gives the impression like changing your physical appearance somehow makes you a better person. It also sometimes masquerades under the banner of health. It tries to sell quick fixes, new you in 6 weeks, all this kind of thing. And it does create this very unrealistic portrayal, which, if you're just a regular person like me, it feels, a little bit unrealistic and can make you feel a bit inadequate. Now, this one, unfortunately, is not specific only to workplaces. We do see this everywhere in day-to-day life, particularly on social media. And I think it has a really big impact on the way we think about and the way we talk about being active, and particularly what active people are supposed to look like. And I think that can creep into conversations with colleagues, and also the way physical activity opportunities within the workplace are presented. So if you do have a workplace challenge, or there's a gym or anything like that in your workplace, what sort of images and language are actually used in marketing those to people. And the other thing, which I hear quite often, which is kind of bonkers, is people then say, oh, I couldn't get involved in that. I'm not fit enough to join in with that, which always feels sort of ironic, because the point of the thing, is to get everyone involved and to get a little bit fitter together, not to have to be really fit before you start. So happily, there are also some more positive narratives emerging. So one of them is around health and well-being, a much more genuine narrative around health and well-being, in my view. So in workplaces, we're seeing lots more things like active breaks, well-being walks, obviously the Active Souls movement, and also workplace initiatives for specific industries. So active practices, for example, where GP practices are supporting not only patients to be more active, but also their staff. I think the language here is much more about making those small changes. Something is better than nothing, and really a bit of a sense of doing physical activity at your own pace in a way that works for you. Now, there is a little bit of a watch out to be aware of with the health narrative, though, because what we do see is a really big focus on things that we should do. You know, it becomes very about, oh, it's good for you. You know, you should be doing a certain amount of exercise, and I think that can start to make it feel more like a chore, really, or something on the to-do list, and it's no longer the act of self-care that we actually kind of want it to be. And in particular, a lot of this type of messaging has come out of public health and then spread into other places. You probably can't read all the detail of the writing that's on here, but these kind of infographics and messaging and marketing, they're basically a list of instructions. You know, it's telling you what you should do, and there's some quite strict rules, you know, how many minutes you should do, what sort of activity, how intense, how regularly. And oh, there's always a list that comes along with that of all the terrible things that could happen if you don't. You know, you get cardiovascular disease, you'll have mental health issues, you might die. And personally, I don't know about you, but I don't find that particularly motivating. Now, that's not to say these aren't really important. You know, these are brilliant in the right context. These kind of things, you know, they're designed for clinical professionals to persuade them why they should be looking to embed physical activity in patient pathways. You know, they're for funders, they're for employers to make the case for why investing in workplace wellbeing is a really good idea, but they're not designed for sort of regular people in their everyday lives and in their workplaces. And I'm pretty confident that nobody's ever got up off their sofa and said to themselves, oh, do you know what? I think I'll go for a walk because I'd like to reduce my risk of cardiovascular disease by up to 35%. So we just need to think a little bit carefully when we're using this kind of message about the audience and who it's for and what its purpose is. And then this brings me to my final language. This one's my favourite. This one's all about the joy of movement, which I know a lot of people on the call will be big advocates for. So this one's about just having a really great time, you know, connecting with other people, connecting with your colleagues. And this is the one that feels really relevant for workplaces for me, because it's really inviting everyone to be part of something without worrying about who is the best at something. I think this type of language is something that everyone can relate to. And even if you don't look like a typical athlete or you're not particularly good at something, it makes you feel a bit more comfortable just to have a go. So I've thrown quite a lot of information at you there. What I wanted to do now is explore that a little bit more and just take a bit of time to reflect on those different types of language and maybe where we've heard them, you know, examples of how they're used, where they work, where they don't work, and how that might actually feel in different conversations with colleagues in different situations. And then I'd like you to think about the language that you want to use in your workplace to support physical activity in two contexts. So one is in those slightly more formal communications, maybe from employers to employees, you know, trying to encourage people to be more active, maybe presenting different opportunities. And then also in those more informal day-to-day conversations, where you're just chatting with colleagues almost amongst yourselves. There is also a bit of a challenge if anyone can come up with a possible strapline or a hashtag or a slogan that they feel brave enough to share at the end. And just to give you an example, one of my favourites, which came from an organisation called Rabble, who run kind of like playground game sessions for adults, which frankly sounds amazing. I've never managed to go to one, but I would really like to if there was one near me. And they always say, if you're having fun, you're doing it right, which I think is brilliant. Okay, have we got everyone back? How was that for everyone? Some good conversations? Anybody want to share some of what they had in their conversation?
Sure, I'm happy to go.
Brilliant, thanks.
So I was with Julia. It was great. She works in the council, and kind of we work with a lot of different organizations as well-being consultants. So it's nice to hear kind of the pros and cons of all, but I think we kind of end up touching on each aspect when we're supporting people to be more active. Like that competition piece, of course, it can be quite polarizing, right? For some, it'll be very encouraging. That's what you want. And so we've kind of found that actually having like cumulative competitions even can bring that together. So, let's all walk as a team from whatever our London office to the Manchester office in a month, rather than it be me versus you versus whatever the other finance team. I kind of found that with the benefits side, really focusing on that. And we found that, okay, I've got to be active as my to-do is one thing on my to-do list can be frustrating if you don't remember those benefits. And so it's kind of finding the benefit that works for you. So we kind of touched on that holistic approach. So Mental Health Awareness Week was on movement. So how can you link, the benefits to mental health or work benefits, or just whatever that motivator is to you. I know you mentioned, am I going to talk about cardiovascular health? But if someone's a parent and they're going, well, actually, I've got a few friends who are new parents going, oh, I struggle to go up the stairs just then, and I'm, I should probably actually sort my cardiovascular health out because I've got a 3-year-old. Or so yeah, it's just really helping people to carve that out. So we had quite a lot of conversation around that, but I think not to say either one of those 4 languages is right or wrong, but really trying to do that. Kind of my last point was that we do a lot of kind of needs analyses, which I'm sure you do, right? You're in the data side, Danny, which just kind of what do my team need, right? Who am I doing this for rather than to? I'm not doing it to you, I'm doing it for you. So what's working? Would a tennis tournament be exciting for the 5 of us in our team, or is it what do you need, what do you want, what's working already, what isn't? Let's try some stuff out. And also making sure that kind of measuring that, I guess that's next month's thing about measuring, but I think that kind of makes it easier to go, okay, which of these 4 languages is going to suit my team best, or the individuals in my organization. So it was a great conversation with Julia. So
brilliant.
Thanks, Danny.
That's fantastic. Yeah, and I think you're absolutely right. It's not that one is right or wrong, and it's also the language that people bring sometimes, and particularly when people are newer to activity, they often won't see it as joyful. So trying to start with that seems almost ridiculous to them. They're like, getting sweaty is not joyful. So how you can start to build that side of the language in, if they're there for a more functional reason, they want to get the cardiovascular health improved, for example, if that's the reason they've arrived and decided to join in, ignoring that isn't helpful. But you also then want to bring in some of those other languages and sort of mix it up a bit, and hopefully particularly feeling a bit of that joy, so that when it's been a bad day, they don't go, oh, not doing that, that's just another non-joyful thing.
Yeah, absolutely. And to that point, Julia shared one thing that works really well in the council, and I think we've seen this work across other organizations, is those stories of joy. So I haven't been active for X amount of years, I've got kids or whatever, it's a bit worrying, but this is how I took that first step and how I've carried on and why I'm doing it. Or I'm super busy as the CEO, but I'm still finding time. Here's that permission to everybody else to carve that time out. So I think if that language and the stories of that joy, I think is nice.
Absolutely. And the role modeling as well. Brill. Anyone else wanna jump in?
Just looking at the comments, Kate put a really good comment here. Quite like framing things positively and focusing on the immediate benefits. So the immediate benefits that you get from it, which is really important, isn't it? When you think back to some of the health stuff around, this can impact on, stop you developing type 2 diabetes, and you're going, oh, hold on a second, or developing coronary heart disease, you're going, well, that's not, but actually it's
25 years away.
the immediate the feel good stuff from it is, that's really important, isn't it? What you get from it immediately.
But in the moment, helping people find that as well if they've not had that before. You start slowly seeing that come into their mind, going, oh, hang on, maybe this isn't awful like it was at school, and maybe it can be quite fun and joyful and lovely. I'm conscious of time, so should we leave it there first? Is that all right?
Yeah, that's absolutely fine. And I would say any other reflections, thoughts on it, just chuck it in the chat. If you've got any questions, once we've gone through sort of Andrew's bit, we can come to that at the end as well. So thank you very much for that, Danny. That was really great. Something for us all to think about. And I'm going to pass over to my colleague Andrew now, who's going to talk to us about framing and what framing is.
Well, absolutely, and that is definitely going to be the first piece to tell everyone, for those that aren't necessarily aware of framing. I'm just going to kind of talk a little bit about framing and what it is, and a little bit about the kind of journey that GM Moving have been on as an organisation, but also with partners. We've worked very closely with a consultant called Nikki Hawkins for a number of years, and she's really helped us with kind of our framing and supporting us with that. So framing in its simplistic form is what we say and how we say it. So it really does link in very closely with a lot of the stuff that Danny has been sort of outlining this morning, and kind of ensuring that we give due consideration to what we say, and that means that can be kind of what we lead with, i.e. what's the first thing and most memorable thing that we say, what do we repeat, what do we emphasize, how we explain something, and also importantly what we don't say, because those things we know from various bits of research affects how it's heard. So your understanding or your ability to understand how you feel about something, again Danny kind of mentioned that around sort of the competition sort of language that she alluded to, can make people feel quite excluded or kind of other negative feelings. What we say and how we say it can affect people's actions, so directly kind of how likely they are to potentially participate in a workplace well-being scheme or program or anything else that you're running, and then also kind of your policy preferences as well. So there's an example there on the side around the kind of focus on sports and around childhood obesity, and what the academic in that report kind of goes on to say is that it is a whole school system that is needed to tackle kind of childhood obesity. You can't just rely on sports, and then it's looking at sort of the whole school system, governors, teachers, parents, to and from school, during maths, during English, and that's the Creating Active Schools framework that academic is very kind of heavily involved with. So I've put a couple of examples on the table just to kind of allude to what the journey that GM Moving and a couple of our close partners have been on, and very much moving away from the kind of inactivity is bad and that you need to take your medicine kind of language and framing, and moving that towards a moving is brilliant and join in the joy. So it's very much kind of around those immediate benefits that people have alluded to in the chat, and also around the kind of mental well-being and the mental health side of things as well. So there's that immediate feel-good feeling.
Go and answer that, because I think it might be Granny. Just say that Mum's in a meeting.
So it might be that
table there.
really good positive feelings that people can get from moving. There's also stuff around kind of people making better choices, and I'll come back to that sort of later, but we can reframe that to people creating a system or a workplace where moving is possible and encouraged. And so it's not around kind of new ways to tell people to move more, but just designing it back into life, so it's a natural, easy choice. So there's a couple down at the bottom there that I've kind of left open, and I feel that feel free to have a look at those and maybe put some suggestions in the chat, or if you're feeling super confident, feel free to shout them out. I mean, there's no kind of, I suppose the good thing is there's no wrong answers in this kind of side of things, but if you think in how you could change the frame of I need to be at my computer to something that might be a little bit more positive or movement encouraging, then feel free to kind of suggest that in the chat. Why don't I give you one to start off with? So instead of kind of needing to be at my computer, you could kind of look at like a walking meeting as a different kind of alternative, which kind of is obviously kind of encouraging that physical activity, but continues to be sort of productive. So if there's language around nobody using the standing desks, how could we sort of look to reframe that, and the sort of maybe any questions around trainers or active souls, as we often call them, being unprofessional, how could people look to reframe that as well? So don't know if anyone's feeling particularly brave and wants to shout out, or is feeling more confident just to put it in the chat. That's absolutely fine as well. Thanks, Danny. Oh, sorry, go on, Alex.
Because I can probably do the trainer one, because I've been working on active soul, so I suppose that was moving from trainer to unprofessional to something along like work gets done when I feel comfortable. Yeah. And who I am.
Yeah, absolutely. Doesn't really stop you doing anything 9 times out of 10. And exactly as you say, yeah, you can do that. And then Julia's put in standard desks can change your space, so you can look at different options. There's loads of things you can say, and by no means am I now going to give the correct answers, because that's not how it really works, but just as an example. So to sort of reframe around nobody using standard desks, be great if they're role modeled by senior staff. So that's one option. And then again, trainers are unprofessional, but like Alex said, I work better when I move during the day. So if you have active souls and they're allowing you to move more during the day, whether that's kind of a lunch break or sort of moving more on your journey, your commute into the office, then you can work better during the day. So that's really really positive as well. So the things to be aware of when framing is the assumptions that people make on physical activity, and these might be quite familiar to a lot of people, but what these assumptions are constantly reinforced by what people see and what people hear, and that is in the language that we use, but also in what people read on social media, in the media, newspapers and TV and stuff. So the assumptions that people make is around physical activity is all about willpower and choices. So that if people made better choices, then they would be kind of physically active more often. There's another assumption around physical activity as being vigorous and scheduled, and that there's kind of no pain, no gain, and that modern life kind of prevents us or stops us from being active. And the sort of lazy assumptions based on those things are that if we educate people better, they will make better choices. and therefore be more physically active. And the onus is very much on the individual. Now, none of those assumptions are particularly helpful, but they are regularly reinforced. So what the framing principles that I'm about to kind of run through aim to do is move the conversation away from those assumptions. And by moving it away from those assumptions, we stop reinforcing them, and hopefully we can sort of move the conversation on and open the conversation up to a new, more positive place, whereby those assumptions are not reinforced, and we can begin to change those assumptions around physical activity, so that we bring in those things I've mentioned previously around the joy of the journey, enjoyment and fun. So there are 4 principles which I'll run through now. The first, we kind of refer to widening the lens, and that kind of goes back to kind of that whole system onion and the diagram that we've already alluded to, in that if it's not down to willpower and choice, we know that there are multiple factors at play. There are many things that will impact our decisions and our behaviours, and we need to shine a light on those. So there's an example there around the ULEZ in London, the ultra low emission zones in London, and there's it's kind of Sadiq Khan in that kind of piece is looking to broaden and widen the lens around ULEZ, and saying that it's much more than kind of air pollution, but air pollution means cleaner air, it means breathing better, it means lower asthma, which means lower health costs, as well as it's about climate change, so putting less harmful chemicals into the atmosphere, which will impact climate change. So he's what I think he's doing there, and I could be completely wrong, I think he is trying to widen the conversation around the ULEZ, so into a space that less people will find kind of combative. So if you say kind of things around children breathing clean air, that's a good topic that very few people are going to be arguing against. So that's kind of that. And one for you to kind of think about, which is the question we often get kind of asked in framing sessions, is who has supported you to be active? And feel free to add it in the chat. I won't kind of ask anyone to sort of share anything at the moment, but have a think about the last time you were active or did some sort of movement that was beyond what you would do normally, and think about who supported you to be active. So was that a friend, a family member, a healthcare professional, a work colleague, and what did they do and how did they support you to be active? So think about those many factors that influence your decision to be active. The second framing principle to kind of chat through now is the normalizing the change that you want to see. So consider when you're communicating what your communication is saying about and what you want people to think. So really important point there is people respond to what we think other people think. So the example that I've seen regularly is around lockdown, and people kind of were sticking to the rules in the majority, not necessarily because of any health kind of data or information that had been shared, but as much around because they thought everybody else was obeying the lockdown restrictions. So by that social reinforcement is really strong. So in terms of framing, if we can show that there's support and enthusiasm for change, particularly if it comes from a range of different people, that can be really powerful. So there's a couple of examples on the screen. The bottom left one is the GM Moving Conference from a year ago, where at the start of the conference, we just got everybody up and joining in with Dance Syndrome. So immediately from a conference kind of point of view, we are trying to normalize the movement in every day. So we've got a couple of hundred people there in conference space at the Etihad Stadium, and we are trying to encourage and show that movement during the day is a normal part of how work can and should be done. There's also that lovely image on the right hand side, which is from a recent active pregnancy report, and I suppose that's just to demonstrate that the imagery can be as important as the sort of written word. So that image is very much normalizing the change that people, particularly the Active Pregnancy Foundation, want to see. In the top right there, you've got a news item from UK Active, really emphasizing that there is this kind of demand and social demand for change in terms of prevention, and that is kind of what I think they're sort of looking to do there, is really emphasize that the demand is there, and that is kind of a social kind of norm, as you like. There's a couple of other options in terms of tweets that I've just picked out. So Dr. Ashley from the University of Salford is a big advocate for squat breaks. There's a video there of her encouraging a workshop to sort of get out of their chair and get moving, and really she is trying to normalize the boost in mood, concentration and productivity that squats and strength-based work and any kind of exercise can really help with. And there's also a lovely Active Souls example there from Sarah, who's part of the Active Partnerships national team, around her wearing her Active Souls and kind of sharing the impact it had and how it kind of ensured that she could be active throughout the day at a conference and was more comfortable and probably was more productive as a result. So the third thing is around being jargon free, and I don't think this will necessarily surprise too many people, but really thinking about the most down-to-earth language that you can use, because even when you explain jargon, it impedes understanding. People feel bad, it feels quite exclusionary, and it makes them less likely to engage in the issue. So there's a couple there on the left-hand side, which I think probably come up fairly regularly, and acronyms as well can be a barrier. So if you're using things like CMO, which is the Chief Medical Officer guidelines, MSK, musculoskeletal conditions, those kind of jargons can cause issues and impede understanding. And I have put a link there to the Hemingway app, which is a really useful tool, and it basically gives you can copy and paste text into it, and it gives it a reading score, reading age. And a couple of colleagues have been doing this recently, and a couple of their content that they've been looking at is like postgraduate level writing, and the average reading age in the UK, as far as I'm aware, is around 9. So immediately they've gone, wow, okay, we're really potentially putting a lot of people off just by using language that is far too complex and sentence structure that is far too complex. So how can we make our content more accessible and easier for people to understand by using simple language and down-to-earth words? And then finally, sort of linked to that, there's a important point around explaining rather than asserting. So how we invite people in and deepen understanding rather than telling people. So lots of people won't necessarily see, or you've got to kind of show them that the environment and context shapes their ability to be healthy. So again, it goes back to those assumptions. If people think, oh, I don't have the willpower to be physically active, then it's kind of how can you help them to show them that actually their environment and their context is impeding them, and therefore we can change the environment or the context to invite them in, and use that explanation to make sure that they feel that they are invited, they are welcome, they are included. So there's an example there that I've sort of created around workplaces, whereby if a senior leader or any group of people in the organization can role model those good behaviors, create a culture whereby active workplace is a core part of the organization, then everyone in the business should feel better and feel more productive and be hopefully off sick less and feel healthier, happier, and more involved in the workplace. So, and that is because moving more is shown to have numerous physical and mental health benefits. So there's a real kind of leading people through the steps and making it really simple and easy for people to understand. So yeah, that's kind of framing in as short a period as I could kind of get through, really. I've got my email address there. There's also an email address for Karen, who is another strategic lead in the marketing team at GM Moving. So either of us be happy to answer any questions or anything else if you've got questions on that around framing, or if we have time, Claire, I'm happy to have a chat now, if that's helpful for people.
Yeah, I was just going to say, we've got sort of 15 minutes left. We did think about putting people into breakouts again, just with some questions that we sort of had posed, really. But I don't think we've got time for that. So I think this is just an opportunity now for people to kind of reflect and I guess feedback on some of what they've heard. It would be interesting to know where people have used sort of language and framing, and what the impact of that was. Was it successful? Did it feel hard? Did it work? Who was involved in that? And then equally for people who this might be sort of a bit new to, do you know, what have you taken from today? Do you know, has it resonated? Has it made you think? Is it confusing? Has it been useful? So any of that, really, just feel free to, I would say, put your hands up. Go on, Neil.
Just a thank you for me, really. Really great session. All really good content. And actually for me, when you're working in isolation, it's really good to know that the way that we're doing things up here in Leeds with our Active Workplaces network and using lots of different nuanced ways of communicating with lots of different people is probably along the right track. And great bit around the language and the framing. So a big thank you from me, really good. Really enjoyed the session.
Well, that's good to hear. Yeah, and for people who don't know, Neil, they're doing some really great work up in Leeds around that Active Workplaces space. So yeah, we value your input, you know, coming along to these sessions, Neil, for sure. So anybody else, just, you know, feel free to chuck it out there. Do you feel like you're going along the right lines with it? Any other feedback? I'm conscious we've got about just under 10 minutes left. Oh, go on, Danny.
I was just going to say I've been reflecting on, so Andrew put a comment in the chat sort of a bit earlier on about the importance of imagery as well, and I guess the sort of consistency between all those things for me is really important as well. You know, if you're using certain messaging but then your imagery is completely contradictory to that, or maybe you've got you know, a nice sort of initial framing of your I don't know, program or whatever, but then when you actually get into the detail underneath and the way people describe it becomes a bit more not what you thought it was. So that consistency, I guess, across all the parts of your messaging kind of coming together and really sort of giving people confidence, I suppose, what this thing is that they're kind of entering into, and not sort of getting a bit of a surprise.
So yeah, before we sort of log off, really, it's just a reminder about the themes for the next community of practice. So the next date we've got set up is the 15th of October, and that's around measuring impact and learning. So again, this is, a shared space. So we want other people to feel that they can influence and share some of that. So it'd be really, really great if there's anybody on the call, or if there's colleagues you think, oh, actually, yeah, we're quite happy to share something at that session, because that's how we're going to learn. We don't want to be the ones who just feel like we're talking at you. We want this to be a learning space. So if people want to have a think about that and come back to us, we'll send out the slide deck afterwards. So there'll be a contact email, or most of you will have contact for one of us. Please get in touch with us, and that would be really, really great. I think Khalil, you've sort of offered to help with one or both of those as well. But yeah, we want to make this space as useful as possible. Just to say as well, Alex has put in the chat there, but we do have a Padlet. And what we want, because one of the things that came out of the January session, and people will hear this all the time in lots and lots of different rooms and spaces, is where do we find information out about this? There's lots and lots of great resources out there. Sometimes you have to look for them. So what we were trying to do with the Padlet is actually to create a shared space. If people have really good resources, information, we can use that Padlet, we can use that space, which you'll all be able to access because we've got the link for it there. So it shouldn't just be about what we put in there, but if you've got a really great resource or a good case study or some kind of learning or something that you read about, use that space. So we've all got access to that. So we will make sure that the slide deck and the recording from both Danny and Andrew are in there, for example. But please feel free to also use that so we can all access this. So I think on the mail out list for this, we've got about 80 people, so they will be able to access that as well. So obviously the more that we put in there, the more useful it's going to be for everybody. So that's just a reminder about that as well. So I'm just checking.
Are sign-ups open to attend those next two community of practices yet, Claire, or will they be opening soon?
We will send out, because we've been doing it by teams, so we will get those in the diaries and we'll send them out before the schools break up anyway. I think we'll do it in the next couple of weeks, so we'll get them out there while it's all fresh in everybody's mind. And please speak to other people, share this, and like I say, that's another call and shout out for people to join us with this and help with the planning, or put your hand up to support us with the next session. It would be greatly appreciated. Alex, have you got something? Did you put your hand up there?
No, I was just going to say, yeah, good. I'll try to do a love heart for yes. This isn't just about us doing it; it's about opening up to anyone else that wants to help us or help the group grow as a community of practice for active workplaces.
And suggestions of speakers as well. People that you might have heard in another space, you think actually they'd be really great to come on board and share something with us. Let us know about that as well. That's always really useful. So, I would say in the spirit of active workplaces, we'll give everybody that time back to go and do something before your next meeting. If you've got another one at 11:30, go and shake off your body, walk up the stairs, get your dumbbells out like me that I've got in my sitting room now. I knew you'd love that, Ashley. And thank you very much for joining us this morning.